Good morning, class. In this video, we are going to talk about prenatal care, the changes noted by a pregnant woman with her body, and also nutrition. What is the best or what are the food that are necessary to make sure pregnancy is healthy? So, pregnancy can be exciting, but it is a daunting experience. So it is important for the woman to learn about the process of pregnancy. What are the different types of care available? And how can we assist her to alleviate her anxiety and build her confidence in order to take care of that fetus inside her womb? So we can offer information, education, specific details such as what can a woman expect each week. What are the different prenatal testing to ensure the health of the baby? We will also discuss the importance of proper nutrition, vitamins, the need of hydration, and very important, the need to rest during pregnancy. The end goal that we have for the pregnant woman is for her to deliver a happy, healthy baby. So there are a lot of changes in a woman's body during pregnancy. So it is important for us to assist the mom to adapt these changes, which occur early in pregnancy, as early as 5 to 7 weeks. That's basically 2 months. These changes occur in preparation for the demands of the growing fetus. This means it is vital for women to be healthy upon conceiving because these changes will really affect the day to day living of this woman. So, good health to start with is important. So, just a brief review, although we will have this in detail further. One of the main changes that can happen in pregnancy are the hormonal uprising. This is the endocrine system producing various hormones. This is the central driver of changes because, as we know, hormones do the biofeedback mechanism inside the body. We can start with the hormones in the placenta. We have the human chorionic gonadotropin or HCG. This is in support of our corpus luteum, which is in the reproductive system. The increase in HCG causes nausea and vomiting. Progesterone, as I discussed last time, it means progestation. This is the hormone that increases to support pregnancy by relaxing uterus so it will not be contracting and expelling the contents. So uterine relaxation. But at the same time, it also decreases GI motility, which can lead to constipation. We have the estrogen, which promotes uterine growth, and at the same time, breast will start to enhance more. HPL, which is for insulin resistance, and this increases fetal glucose. We have relaxin, which softens the cervix and favors pelvic ligament relaxation. Other changes are pituitary changes. One is an increase in prolactin, which is for breast development, and the other one is a decline in FSH and LH, or your follicle stimulating hormone and luteinizing hormone. Changes can also be gestational diabetes, nausea, and ligament laxity. Aside from the endocrine, we have changes in the cardiovascular system, which is most marked. We have an increase in blood volume and in the RBC mass. This can lead to physiological anemia because the concentration becomes more uh, diluted. Okay? There's more volume now, 40 to 50%, while the RBC mass is 20 to 30%. There is also increase in cardiac output. That means more work for the heart, about an increase of 30 to 50%, and an increase in heart rate, which peaks at 20 to 24 weeks. Blood pressure also goes down, the systolic blood pressure, and this happens in the second trimester. On the other hand, we have compression of the veins, which can lead to varicosities and hemorrhoids. So, very important that we instruct our mothers in order to relieve this supine hypotensive syndrome, which is a drop in blood pressure. This is relieved by left lateral positional change. Okay, so mom has to lie down, turn to left lateral position, turn to her left. This favors the right side to be elevated and free from constriction to allow good flow and counter the supine hypotensive syndrome. Okay, take note, turn a mother to the left side. We also have changes in the size of the abdomen. Okay? So as early as we have the 12 weeks, the fundus is just above the pubic bone. That's basically around 3 months, okay? 2 to 3 months. And as the fetus grows inside the womb, the size of the abdomen, the fundal area, is also increasing in height. So as you can see, in 36 to 38 weeks, fundus is already right up under the sternum, but in 40 weeks, the fundus drop below. That means the presenting part of the fetus has already dropped down to pelvis. So that is actually one sign that the woman is about to get ready to deliver, because from a higher fundal line, it will start to descend beginning 39 to 40 weeks. So again, these are a picture of the physiologic changes. We have the hormonal, which we have pointed out earlier. The human chorionic gonadotropin is increased, progesterone, estrogen, relaxin. We have key related symptoms, which are mom is now not ovulating. There's no more menstruation. We can actually, the mom can actually be telling us there are some contractions that she feels. These are mild contraction. We call them the Braxton Hicks contractions. It's not a major contraction that will expel the fetus, but because of the changes in the uterus. The breast tenderness is really felt. And because of these changes in hormones, it can affect the mom's sleep pattern. We also have some respiratory changes. You know, there was already a change in the cardiac volume. This also affect respiration, gas exchange, lung volume, and capacity. So the pregnant woman now has increased sensitivity to carbon dioxide, and she tends to hyperventilate to expel this carbon dioxide. So the lung volume, the capacities, and the ventilation rate changes. Diffusion gradient also shifts. In terms of anatomical form, the diaphragm, which is our muscle for breathing, is displaced because of the enlarging uterus. The thoracic cage expands, thereby, because of it, the chest wall compliance decreases. That cause the changes in the respiratory function or the action. Okay. There will be some upper respiratory tract nasal stuffiness and probably rhinitis, all because of these hormonal changes. And because of this change in the chest wall compliance with the enlarging and displaced diaphragm, I mean, not enlarging, but the displaced diaphragm due to enlarging uterus, the woman will start to feel dyspnea as early as first trimester. Other things would be so here is basically in summary, you have hormonal changes, okay, which is your placental hormonal changes. You have your cardiovascular changes that we have discussed. The blood pressure falls, take note. There are a increase in plasma volume leading to delusional anemia. We have increased sensitivity to carbon dioxide, a displaced diaphragm. Now, in terms of musculoskeletal, there is weight gain, which is caused by the hormonal changes. And look at the position of the woman. The woman assumes lordosis, which like tipping back of the spinal cord. Okay? This is the woman's attempt to stretch the abdominal area. Okay? This is also characterized by joint and ligament laxity in the lumbar spine and pelvic region. This is because of the increasing weight in the caused by the enlarging uterus. Now, what are some signs of pregnancy? This is actually categorized into three kinds or three levels. So we start with presumptive signs. So when we say presumptive, this is not 100% showing that the woman is pregnant, but a woman can start presuming that she can be pregnant. So we have amenorrhea, that is absence of menstruation. She starts feeling nausea and vomiting. There are breast changes. She goes fatigued, very drowsy, and the pressure of the enlarging uterus on the urinary bladder is causing frequent urination. She feels a lot of movements in the uterus, and we call that quickening. And the changes in hormones causes a lot of pigmentation in the human body, like darkening of the armpit, uh, cloasma, or some changes in the face. Then we have these probable signs. Probable signs, there's now an increasing probability that yes, indeed, the woman is pregnant. The pregnancy test shows positive results. The abdomen is indeed enlarging. Okay? There's a lot of uterine changes. We have this ballotment, like a movement inside the womb. And we have Braxton Hicks contractions. The uterus on and off makes this contraction. Uh, but we don't yet call this positive because the only time we can say that indeed there is a pregnancy, we are confirming pregnancy is when we actually see and hear the fetus. Okay, take note. When we actually see the fetus in an ultrasound, that's when we can really say 100% this is pregnancy. This is the positive sign. Um, if there's no ultrasound, at least we hear the fetal heartbeat and we feel the fetal movements. So these are positive signs of pregnancy. So to summarize those signs, when we say presumptive signs, these are generally presumptions of the woman, subjective symptoms experienced by the woman, such as amenorrhea, nausea, and fatigue. Thereby, these are not conclusive proof of pregnancy. Probable signs, on the other hand, are more objective, that these are changes observed by the healthcare provider or us nurses, like we see or we gain a positive pregnancy test. We noted the abdominal enlargement, and we feel, or the woman would show us that, and we can actually feel it, the contractions of the uterus, which is called the Braxton Hicks. But the positive signs, these are the definitive clinical evidence of pregnancy, which is best visualized in an ultrasound. But without it, the other positive sign is hearing the fetal heartbeat using the stethoscope and feeling the fetal movements. Okay, so let's proceed now to the common discomforts during pregnancy. Because again, our goal is to help the mom take a positive position and well being. And to anticipate these discomforts will help the mom adjust to the changes. So, common discomforts which are temporary but not very exciting part are the nausea, the vomiting, heartburn. These are all hormonal, caused by hormonal changes. The muscular changes brought about by the enlarging uterus. You have your back pains, round ligament pains, the pushing of the uterus in the bladder, which leads to urinary frequency, the hormonal change, which cause uterus to relax, but at the same time also causes constipation. The changes in the veins, which leads to varicosities and at the same time hemorrhoidal disease and the leg cramps. So, very temporary part of the changes and can be relieved as a pregnancy continues. There are pains as well during pregnancy, and it's important that the woman knows when is this normal and when to seek medical attention. So, cramping, but it must be mild only. Pelvic pain, that's because of the enlarging uterus pushing on the pelvic ligaments. Feeling bloating, eh? Stomach pain, bloating due to the GI changes. You have your lower back pain, breast tenderness from the increasing estrogen, headaches from the pressure increased uh, blood volume, leg cramps from the varicosities and vessel changes, and round ligament pain from the enlarging uterus. Also, because of hormonal changes, we have a lot of uh, pigmentation that can occur in a woman, such as acne, hormonal acne during pregnancy. So, It is important that the woman discuss first with the doctor if she plans to take over the counter medications. One thing we have to highlight to our pregnant moms are avoid retinoids. Retinoids can be teratogenic. Retinoids can be teratogenic. Now, try only natural remedies like Greek yogurt, face mask, or blue lead therapy. Now, use gentle natural cleanser. Resist the urge to pick at her face and don't overdo skin treatment. Okay, that can have a harmful effect on the fetus, especially certain chemicals involved in the skin treatments. Now, let us discuss further how important is prenatal to make sure we have a healthy pregnancy, and that includes nutrition. So, what is prenatal? Prenatal is a form of healthcare designed to keep a pregnant woman and her unborn child healthy until birth. Now, during prenatal care, mother undergoes regular medical checks, and that is what we always emphasize with our moms. They have to see the doctor so that the doctor can monitor her health and also that of her baby. And when is prenatal period? Okay, prenatal period is from the beginning of the conception until the end of pregnancy. Okay? So generally, for easy memory, visiting the doctor usually is every 4 weeks. That is from beginning up to the 28 weeks, but towards the 8th and 9 months, or the 8th and 9 months, the last 2 months, the visit is every 2 weeks, not just every 4 weeks or every month. It should be every 2 weeks. And after the 36 weeks, which is already on the week of delivery, the visit should be weekly. Okay, take note of that. The reason is that we are able to evaluate maternal and fetal health more closely, provide education to the mom to make sure she knows what to expect and when to call for further monitoring, so that intervention is given whenever possible if there is risk ongoing. Another term for prenatal care is also antenatal care, which is again providing care to a pregnant woman. It involves medical checkup, education, and support. So they're the same term. Okay? And again, the weeks are the same. Other terms that is used: early pregnancy every month, mid pregnancy can be between 2 to 3 weeks. Take note, in the later part, it becomes weekly visit. Okay. Now, postpartum, after delivery, within 6 weeks after delivery, the mom has to be checked again to see how she is coping. Now, during examination, what are being tested? The weight of the mom. So, as nurses, these are the things that we also do when we receive the mom for checkup. We check their weights, we check their blood pressure. We have laboratory tests to check for protein in the urine and sugar, protein and sugar. This will now focus on nutrition and how is the woman metabolism is. We measure the fundal height of the uterus so as to see if the fetus is growing. We listen to the fetal heart rate using our Doppler and our stethoscope. Ultrasound is being done on a certain timeline. So we see the actual fetus, or we visualize the fetus, and as well as see and hear a fetal function of uh, especially the heart. Certain blood tests are done. So to check for anemia, the blood type of the mom in preparation for a possible blood transfusion, to check if there are infection going on, especially in the reproductive area, check for diabetes. We give our education, make sure the diet is balanced, high in iron, calcium, folic acid. These are important vitamins for blood production, bone formation, especially for the fetus, the formation of the spinal cord of the fetus to avoid those defects in the uh, growth and development of fetal bones. Um, Avoid alcohol, no smoking, limit caffeine intake. Caffeine, as we all know, causes changes in rhythm of heart. Okay, and there's already a lot of cardiovascular changes going on, so we do not want to add to that. Exercise is encouraged, moderate exercise only. Okay, so there are important exam points. You see it in the box: weight, blood pressure, fetal heart rate, urine, and blood test. And then your weekly examination of the woman, and towards the later part of a pregnancy. So again, prenatal evaluates pregnancy. This is a summary. Assess the mother and the child so that we can intervene if there is risk ongoing, and we educate the mom so that we decrease risk. That's why we do counseling and do appropriate intervention. Now let's go to what are the factors that has to be addressed in prenatal. So as you can see, number one is nutrition. Nutrient-rich food is vital in promoting mother's health and baby's growth and development. And part of nutrition, our assessment is weight gain. Now, note that although it is normal to put on pregnancy-related weight as the baby grows, limiting the amount of weight gain can contribute to better overall health. So we want the weight to be substantial and necessary. We do not want the extra weight. So the type of food that the mom eats is very important. And monitoring the weight gain is also relevant because when it is excessive, it is a sign of something risk to the woman. So much also for a low weight gain. So it has to be enough to for us uh, to be assured that it is a growing fetus. That's the cause of the weight gain. Mom has to be kept hydrated. This is key to a healthy pregnancy because water helps body perform various functions that keeps the body healthy and support a developing baby. Another important activity is sleep. Pregnant woman may feel more tired than usual, so it's important to get rest as much as necessary. Exercise also helps pregnant women prepare their bodies for the big day, which is the delivery and the recovery after childbirth. And again, women may need supplements such as vitamins and minerals because these are much needed nutrient not only for the mom but for the baby. Again, a good prenatal care, as you can see, every month in the first 28 weeks, every 2 weeks between 28 to 36 weeks, and in the last month, it has to be every week. Okay? Uh, Vitamins, diet, exercise, sleep, and rest. Very important. Benefits of prenatal care, it lowers the risk of low birth weight. It lowers the risk of premature birth and it lowers the risk of neonatal death. It also promotes mother's health. With prenatal complications are spotted early on, we are able to monitor and you know ensure healthy weight gain and education counseling can be done so the woman is supported and guided. So take note of this slide, very important. Every 4 weeks within the first to 28 weeks, every 2 weeks until the 36 weeks, and every week until delivery. So we remind this to our pregnant moms. Now, what happens during prenatal visit? So in the first visit, this is when pregnancy is confirmed. The mom knows her due date. We will also do a medical and family history. We check for baseline blood pressure, height, weight. We do a full blood test, a urine test. And for the fetus, screening for Down syndrome can also be done already. Cervical screening for any changes, infections, and we can check the mom for vitamin D deficiency because remember, this is a vitamin important for bone development. And then every appointment, the mom's blood pressure is checked, fundal height is assessed, heartbeat and movements are monitored. Now, in the first 19 to 20 weeks, that's about first 4 month, ultrasound is done uh, to see uh, the actual fetus. Okay? And then somewhere between 26 to 27 weeks, we do a blood test for glucose tolerance to check for diabetes. By the end of 28 weeks, we already start talking with the moms about birth plans. How does she plan to bring home the baby? What are the blood tests being done? If in case mom's blood is Rh negative, this topic is discussed most in pediatrics, okay, and also towards later of OB class. The need for the anti or the injection against the what do you call that, the incompatibility of blood, the vaccination necessary to prevent pertussis or whooping cough, and the different urine tests. Now, towards the 34 to 36 weeks, we may do a vaginal swab for Group B streptococcal infection, that is to protect our baby when it slides through the vaginal canal during delivery. Again, we discussed the anti-D injection, which is the incompatibility occurring if there is Rh incompatibility of blood between mom and the baby. And then most importantly, this is the time we assess what is the baby's position because if it's not cephalic, we may have a problem, okay, or we may have to do further interventions before we actually have the mom move forward for possible already engagement of the presenting part in preparation for labor and delivery. We may do emergency cesarean section if the presenting part is not viable for labor and delivery. Now, some tips for prenatal care during the first trimester. First trimester is the first 3 months of pregnancy. Take note, there must be a prenatal visit that will establish our baseline data. Blood tests and screenings are done. Uh, we educate the mom to maintain the healthy lifestyle, and so we discuss with her lifestyle choices. We do weight monitoring. We educate mom about the different symptoms of pregnancy, and we check with her so that we can right away anticipate if there are risks. We already start discussion about genetic testing for incompatibilities and family history, genetic lineage. We tell the mom when do she come back and how often. And we anticipate some discomforts and we can tell the mom if it's normal or something to be reported. It is very important on the first visit that mom feels confident to be open in her communication with the healthcare provider. Now, in summary, how to stay healthy during pregnancy, we emphasize healthy diet, the taking of prenatal vitamins that is this prescribed by OBGYN. Very important to highlight, prescribed by your OBGYN. As avoid as much as possible food that are raw, uh, because there are uh, vectors that could ride with a raw food that is harmful to the mom and the fetus. Avoid alcohol, avoid caffeine, drink more water, get moving, okay, exercise, no smoking, enough sleep and rest. And in terms of food to eat, important that we build a diet that keeps the baby and the mom healthy. So during pregnancy, eating a healthy and balanced diet is necessary so the body gets the nutrients that it needs. The nutrients are substances that our bodies need so they can function and grow. So we know these nutrients. These are your carbohydrates, fats, proteins, vitamins, minerals, and water. So for a pregnant woman, nutrition is more important than ever. And the woman needs more of these many important nutrients than when she was not pregnant. So making healthy food choices every day will give the baby what they need to develop and to ensure that the baby gain healthy amount of weight. So what is the expected weight gain during the pregnancy? So take note of this number, 25 to 35. That's basically the average weight, total weight for a pregnant woman. This is about 6 pounds in every 3 months, and then up to a pound every week. Again, 6 pounds in every 3 months, and then so that would be a total of 18 pounds, and then a pound, up to a pound each week is normal. So a total of 25 to 35. So below 40, uh, let's say below 25, so a total of 28 to 40. That is generally on the underweight side. Okay. Um, Overweight woman, 15 to 25 pounds. Obese woman, a gain of 11 to 20 pounds. Sorry. These are the expected weight gain. Okay. So average weight for a woman is 25 to 35. Sorry, I was saying the wrong lines. 25 to 35 pounds is the total weight gain of an average woman. But if you start underweight based on your BMI, you are underweight, the gain should be more. So 28 to 40. If by the start the woman is overweight already, then limit the weight to 15 to 25 pounds. If the woman is obese, then limit the weight to 11 to 20 pounds. So um as you can see here, the number is only between 20 to 25, meaning the fetus is generally weighing only 20 to 25 pounds on top of whatever is the current weight of the woman. So this is to ensure that the weight gain is really the fetus growing and not the woman. Now, there are certain tests done also on the fetus which ensures fetal well-being. We call this the biophysical profile. Okay? Biophysical profile. So you have here A, B, C, D, E. So A is the fetal breathing movements, one episode of 30 seconds in 30 minutes. Then B, we have the fetal tone. This is at least one episode of extremity extension and flexion. And then the body movement should be 3 episodes over 30 minutes. As for amniotic fluid, there should be more than one pocket greater than 1 centimeter in two planes. And then in the non-stress test, the result should be reactive, meaning an increase in fetal heart rate with activity. Each has a possible score of 2. The maximum score on this biophysical profile is 10. 10 means fetus is doing well. Um, these are details into when the biophysical profile is done. This is the choice for follow-up of fetal evaluations. Uh, the OBGYN will be doing this test. So just so you know, these are the things that are checked during ultrasound. And then other things that are tested would be through amniocentesis, wherein LS ratio is tested. This LS ratio is actually a check on the surfactant and the health of the lungs of the fetus. Oxytocin test is also done. This is in preparation for labor. Oxytocin is the hormone that favors uterine contraction. A non-stress test is done to check how is the fetus gonna manage himself or herself when the mom is about to deliver, and then the estriol level. So these are assessment for the fetus to check how healthy the baby is. Can it withstand labor stress when it's time for the baby to be delivered? So these are methods of evaluating mom and baby during pregnancy. This is your biophysical profile. If you see it in the fourth line, ultrasound, non-stress test. We also have contraction stress test. Earlier, it was mentioned the RH compatibility. That's your Rhesus screen. Anemia screen, that's the amount of RBC. Remember, there is a physiologic anemia that can happen. Amniocentesis, we're checking the amniotic fluid, which is going to show us a lot of data such as maturity of the lungs, uh, genetic profile of the baby. Um, Umbilical cord sampling can also be done depending on what risk is noted in the moms. That will be discussed further when we proceed with our OB lecture in the next few weeks. So these are some of the tests done on the mom during the prenatal visits. So in summary, okay, giving birth and being born bring us into the essence of creation, where the human spirit needs to be courageous and bold, and the body shows us the miracle, okay, a miracle of wisdom. Okay, so having being pregnant, giving birth, and for us just being born into this world, we are a product of a miracle of a human body. Okay, so that ends our discussion. Thank you for listening, and I will see you in the next lecture day.